Ashley, and I'm going to change a central line dressing. So first you'll look in your MAR and you'll look at this as an order. So then you obtain all your supplies. So I have my kit here, I have sterile gloves, and so I got some clean gloves. And then you go into the patient's room and you'll explain to the patient what you're going to be doing. You'll perform hand hygiene and do all your patient identifiers and make sure you have the right patient, all that good jazz, and then you will start with your dressing change. So, like I said, you make sure that you have clean hands, and then you would raise the bed to appropriate height, and you would flatten the patient. So, just make sure that you're in a comfortable position to do the dressing change. So, I'll don my clean gloves. I will don a mask and I will put a mask on my patient, or I'll ask my patient to turn away as I am assessing his sight and to remove the dressing. So you're going to look at it, you're going to make sure that there's no redness or any type of complications, and then and all that, and you know, just make sure that it's okay. And you can kind of start getting your supplies ready. So then kind of just less work when you have to remove the dressing. So I'm just going to open my packages up and then have that ready. Okay, so then I'm going to remove this. So first you're going to start with loosening the edges. Is moving too much here. Go all the way around and loosen the edges of the dressing. Make sure your cord here is nice and loose around the table or the dressing. Also, you don't want to get stuck in there. And then you just kind of just start pulling opposite directions, and it just kind of loosens it up quite a bit. So you got that done. You're gonna look at it again, and then you know, clean it up if it needs to be clean. You're gonna assess your dressing, make sure there's no leakage or fluid or whatever. Just make sure your dressing's like intact and clean and there's no complications in your dressing. So you do all that, and you're gonna remove your gloves. You're gonna perform hand hygiene, which I'm going to because it makes my hands less feel like they're sweaty. So, and like with your packaging, you're gonna make sure the package is intact. You're gonna look at your expiration dates, make sure that everything is good. So you're gonna pull this out of its package, and then you figure out how to open it, I guess. So you can put that there, and then here's my mask. Here's extra pair of gloves. So you make sure that away from you first. Put them over there. Just touching your outer border. Okay, then I'm gonna get my sterile gloves on. Okay, so you'll pick up your dominant hand first. Then you pick up your other one. Gosh. hardest part of the job. Okay, and that was okay because it was still within my border. So if it does hit your border, you're going to have to get new gloves. Okay. So I have my gloves. Now I can start touching my sterile field. So I'm going to pick up my chlorhexidine here and I'm going to snap it. And you're going to scrub, you know, kind of tough, and then around your cord here. Careful not to, and then the cord itself. And you're going to be careful not to contaminate your sterile. So you're going to discard that in the garbage. And then you can use chlorhexidine, or you can use alcohol or betadine. So these are irrelevant. You probably could use the alcohol swabs before you use the chlorhexidine, but to remove anything that needs to be removed. Okay, so that's gonna dry. Then you're going to place your you have a little micro orbital antibacterial little tiny pad, and you're gonna place that right here with the slit facing upward, and make sure that it's on right, like the back. There's a proper way you put it on, so you just make sure that's right. And then you would do all that, and you obtain your patch, and then you will and make sure that you can use like a skin prep around the site if you have that, and then you can take your patch here, and then you would just place it around your little hose here. Go around here. And now this is placed, your sterile field is good. Okay, so then you will oh crap, that's not how you do that. Then you will remove this area here on the outside. And then you're gonna pull this label off, or there's a label in here that you can use. You just put the date, the time, and your initials with the dressing. Otherwise, I guess I always use this dressing, and you can do the same. Put your date, your initial, and when the dressing was changed. And then you can secure this part here, this floppy part, down here with the catheter. And you're going to, document the dressing change and any other things that you observed during the dressing change. Okay, thank you.